Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so let's get started. Today we brought a different case where the patient got a golden bridge. It's not exactly the golden bridge, it's a stainless steel bridge with a titanium coating, but it looks gold. However, we want to talk about the lower teeth, the mandible. So when this patient got the golden bridge, she also had her lower teeth done. So in the lower teeth, she had a partial denture, also golden. The partial denture was on her frontal teeth on both of the canines. She broke one of the canines. She had a huge periodontal problem with the partial denture and the teeth. And this is when she came to us. We placed a couple of implants in the posterior parts. We told her not to use the partial bridge because it can harm the implants because it applies a lot of pressure on the implants in the osseointegration process. So in this case, she tried to eat with only those teeth that remained. We added posteriors to the implants, 2 implants on one side and 1 implant on the other side that didn't osseointegrate because some forces were probably applied on this implant. When the whole osseointegration process finished, we realized that she's clenching her teeth and she's applying a lot of pressure on the golden bridge, which was wearing off everything that we did, even the healing caps that were put on those implants. Later on, when the posterior implants were also osseointegrated, we took out the bridge, we extracted the teeth, and we made a small bridge from a PMMA to hold in the meantime to give her teeth to eat with. The posterior teeth were extracted a long time ago, and she was with a partial denture. So she had a very large amount of bone loss and bone resorption. And if there is no bone to place implants on, you need to have a very large augmentation. It's quite a problematic case. In many cases, when patients have a partial overdenture, you can see a very large amount of bone resorption because of the forces that the partial denture applies on the bone. So in this case, because she had only the anterior teeth, this is the only place that we can place the implants. So even in the best case scenario, the only teeth that she's going to be with in the end is maybe first molar to first molar and probably second molar to second molar. You can see here that you have a sleeve on top of the implant. It was just because she broke the crown on the sleeve. She's grinding her teeth very hard and she's always breaking down some of the restoration. The upper metal doesn't help in this situation either because they wear off everything that we did as well, except for the zirconia that won't wear. However, all the temporary bridges are made from PMMA and not from the zirconia. So it can break the PMMA and it can wear down the PMMA. Even the healing caps that we had before just wore off the healing caps. This is due to her grinding. We still added 1 implant where she had left some bone and we went above the mental nerve. And we have this angulation. We'll correct this angulation with angulated multi-unit abutments. You can see that the angulated molar implant is about 45-degree angulated. She had 6 implants, so even though she's grinding her teeth, she has quite enough rigidity for the bridge. When the patient is grinding her teeth like bruxism or clenching, you want to have as many implants possible because you want to distribute the forces in the mouth and a little bit on each implant. We placed all of these implants. We made a PMMA bridge, and you can see that the white color on these bridges are all of the implants. Let's go back to the 45-degree angle. It's on a V-type. It's a straight multi-unit. And in this case, because we have only 1 multi-unit angulated and a V-type multi-unit are not fitted on the cone, it's a flat connection type. So even in a little bit of a problematic case, when the angles are a little bit more than what you can have with a straight multi-unit, you still can use the V-type multi-units and still have a great result in the process. The most problematic part is the milling part, because when you mill on a V-type and you have a very large angle, the milling machine can't mill it. And because the milling machine is the problematic one with the angles. So in this case, we have 45 degrees between this one and probably those that are millable. Because you can mill up to 50 degrees, something like this, we use straight multi-units. Took impressions on all of the implants and then made a PMMA bridge and a zirconia bridge. The zirconia bridge is very important here because due to the fact that she's grinding her teeth, you need to make the bridge from the strongest material possible. If you'll do a PFM or zirconia caps with ceramics, you'll probably have an issue. You can always chip the ceramics. You'll have different types of problems with these types of contractions. This is why we made it from the monolithic zirconia. The color doesn't really matter here because those types of patients prefer it the whitest as possible or golden. We use the zirconia because it's also one unit. It's not the porcelain fused to metal using two materials. It's very strong and it will hold in the grinding process. Now we close the screw channels. We kept the screw channels as small as possible and then we close it with plastic pins. You insert through the plastic pin, the plastic itself melting down on the burr. You can take the pin out with the burr and it's actually quite easy, as you can see. It takes a couple of seconds instead of inserting different types of materials to close the screw channels, and that's it. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course don't forget to like, subscribe, and follow. Thank you and see you next time.